Right, hi everyone. So today we'll start discussing the anatomy of heart, right? So anatomy of heart we'll generally discuss in three stages or three videos. In the first video we'll discuss the localization of the heart and the general anatomy of the heart. So today I'm going to discuss about the localization and general topography and general anatomy of the heart. In the second video we'll be discussing regarding the layers of the heart and the coverings that are covering the heart. Right, in the third video we'll be discussing regarding the systemic circulation as well as the pulmonary circulation. So coming to the first one, right, just for a while forget this diagram. So we'll start with this small diagram. This is how exactly your heart looks, right? Now coming to the exact location of the heart is exactly located towards the left side of your chest. More exactly to say, heart is located on the left side of your chest in the middle mediastinum region, right? So if we discuss about the topography based upon the ribs and topography based upon your thoracic vertebra. First, the topography based upon your ribs are heart extends from your second intercostal rib, right, or your second intercostal cartilage to your sixth intercostal cartilage. Based upon the topography of your thoracic vertebra, taking into consideration, your heart extends from thoracic 5 to thoracic 8, right? If you take your ribs into consideration, so from second to sixth intercostal ribs or intercostal cartilages, heart extends from second to sixth intercostal cartilages, and vertebra from T5. If you take vertebra into consideration, your heart extends from T5 to T8, right? So this is the general topography of your heart. And as I told you, heart is located in the middle mediastinum. Heart has two surfaces, right? The first is the sternocostal surface and next is diaphragmatic surface. What I actually want to say is that if this is your heart, in front of your heart there is sternum, and side of the sternum or attached to the sternum there are ribs. For suppose these three things constitute my heart. In front of this there is sternum, and surrounding it there are ribs, right? So sterno, ribs you call it as costal. So anteriorly you have sternocostal surface, and inferiorly you have diaphragm, so you call it as diaphragmatic surface, right? So there are two surfaces of your heart. One is the sternocostal surface, and that is anteriorly, and inferiorly you have your diaphragmatic surface. And when you see the structure here, you can find two main regions. This is your apex of the heart, and this becomes your base of the heart, right? This is your apex and this is your base. So apex is pointing towards the left side. For suppose if I stand like this and this is my heart in this way, apex is pointing towards left side. More exactly to say, apex is pointing downward towards the left, right? So it is pointing downward towards the left, and base it is pointing upward towards the right, upward towards the right, right? Base is formed by your right atrium as well as your left atrium, but whereas apex is formed by only left ventricle. So you know this one, right? This is your right atrium and this is your left atrium. This is your right ventricle, this is your left ventricle. When you see the continuation of the left ventricle is forming your apex, not the right ventricle. Your left ventricle itself is forming your apex. So in the exams, when you are asked left ventricle or the apex of the heart is formed by, if they give 4 of these names, you need to select left ventricle, because left ventricle itself forms your apex of the heart. Whereas the base of the heart is formed by your right atrium and partially your left atrium too, right? Now, surfaces are finished. Coming to the borders of the heart, there are generally 3 borders of the heart. So these are the lines for explaining borders. This is your right border, this is your left border, and this is your inferior border, right? The part of the heart that is touching the right border is your right atrium. So right border is formed by right atrium, whereas the left border is formed by left ventricle mainly and partially left atrium, right? And inferior border is formed by, most of the inferior border is formed by your right ventricle, and the cardiac apex is also formed by your inferior, forms your inferior border, right? So once again, there is right border that is formed by the right atrium, left border is formed mainly by left ventricle and partially left atrium, whereas your inferior border is mainly formed by the right ventricle and partially your cardiac apex, right? So this is your general topography of your heart, right? Topography based upon the ribs, 2 to 6 intercostal cartilages, topography based upon your, taking into consideration of your thoracic vertebra, that is T5 to T8, and the surfaces of the heart, two surfaces, sternocostal surface in the anteriorly, and inferiorly you have diaphragmatic surface, right? And coming to the borders, right, left, and the inferior border. Now coming to the grooves of the heart, so just forget this diagram now, we'll switch on to this one. So I've drawn this diagram to explain the topography, and now this is a simplified diagram to make the concept clear, right? Now coming to the grooves of the heart generally it has 3 grooves, right? So as you know, this is your right atrium, right ventricle, and left ventricle. So separating this complete atrium and ventricles, separating the atria and the ventricles, there is a groove here on the right and the left, right? This is the groove that is separating the atria and the ventricles. So this groove you call it as coronary sulcus, right? This groove you name it as coronary sulcus. Coronary sulcus is the groove that is separating the 2 atria as well as the 2 ventricles, or simply atria from ventricles. Now there is one more groove. These grooves are not internally. Grooves are externally visible, not internally. Internally you have septums that are dividing atria, ventricles, and 2 atrias and 2 ventricles. They are septums, not grooves. These are the structures which I am telling you, which you can find externally. So coronary sulcus, when you take the heart in your hand, you can find a groove called as coronary sulcus that is separating your atria and ventricles. In the same way, you can also find 2 more grooves. One groove that is separating your right atrium and the left atrium. So here there is a groove like this, right? This is called as interatrial groove. So when we cut the heart in this fashion, and when you see there is also a septum in this, separating the right and the left. So that septum is called interatrial septum. Don't confuse septum with your groove, right? So this is the groove which you find externally, that is separating the 2 atria. So this you call it as interatrial groove. In the same way, you have one more groove that is separating the 2 ventricles. This is called as your interventricular groove, right? Now we shall start discussing the anatomy of the heart internally, right? Now one thing I forgot to draw is here. Now, as you see, this is your right part of the heart, right? This is entirely your right part of the heart, and this is entirely your left part of the heart. This is your right atrium, right ventricle, and left ventricle. This is all you know it before, right? Now, This is internally. I'm talking about the internal anatomy of the heart, based upon the internal structures which are located within the heart, right? So this is the septum, or a wall, that is completely dividing your right atrium as well as your left atrium. So this septum is located between the two atria. You call it as interatrial septum, right? This septum is named as interatrial septum. Now coming to the ventricles, this is your right ventricle, this is your left ventricle, and the septum that is separating your both the ventricles is called as your interventricular septum, right? In the same way, there is one more septum that is completely separating your both atria as well as both ventricles. So this septum is called as atrioventricular septum. So this is your interatrial septum, this is your interventricular septum, and this is your atrioventricular septum, right? I'll label the parts later. Now, as you see here in the ventricles, this part of the ventricles have drawn it so thick, but this part is kept same as it is. The reason behind that is that, you know, left ventricle, when it pumps the blood enters into your systemic aorta, and from the systemic aorta, the blood is supplied to all the parts of your body, to the head, to the neck, to the lower limbs, to the thoracic, abdomen, and to the upper limbs, right? To all the parts of your body, the left ventricle pumps the blood, so that blood enters into the systemic aorta or the systemic circulation and supplies to all the parts of your body. Now, the reason why the muscle, this is the muscle of the heart, which we also call it as myocardium. So there is a thick myocardium in the left ventricle. The reason behind that is that, as I told you, blood through the left ventricle is carried by systemic circulation to your all the parts of your body, right? So to take that blood to your head, to your lower limbs, or to your distant parts of your body, then the blood need to be pumped with high pressures. If the blood is not pumped with high pressures, then there will be insufficiencies of your body without blood, right? That is the reason why there is a thick muscular wall, so that the ventricle can pump so forcefully with high pressures, and blood can pass through all your distant parts of your body, right? So that is the main reason why your left ventricle is thick and your right ventricle is thin, because right ventricle has to pump the blood through pulmonary aorta into the lungs. Lungs are located just behind the heart, right? There is no much distance between the heart and the lungs, so there is no need to pump the blood with high pressures. If there is the minimum pressure also, then we can pump the blood easily, right? So that is the reason why your right ventricle is, the wall of the right ventricle, or the myocardium of your right ventricle is thin. Now, coming to your interatrial septum. In your interatrial septum, this is the heart of the adult, right? For some time, just think this heart is the heart of your fetus, right? If this was the heart of the fetus, then there is a small hole, or there is a small foramen that is located within this interatrial septum. So this small foramen, you name it as foramen ovale, because it is in oval shape, right? So I'll discuss about foramen ovale and one more structure in the fetal heart called as ductus arteriosus. So I'll be discussing those when I take a video regarding the pulmonary as well as systemic circulation in the third part, right? So for a while, just remember that there is a hole, or there is a foramen in the interatrial septum, within the interatrial septum. So that foramen is called as foramen ovale. Immediately after parturition, right? After parturition, immediately this foramen ovale is closed completely with the help of a membrane, and that membrane you call it as fossa ovalis. So foramen ovale is completely closed after parturition. When the lungs become functional for the baby, the foramen ovale is immediately closed, so that the deoxygenated blood in the right part of your heart should not enter into the left part of your heart. For that reason, the foramen ovale is completely closed. And after closure, you call this region of the interatrial septum as fossa ovalis, right? So before it was foramen ovale, when there was foramen. Now the foramen is completely closed by a membrane. Now you call it as fossa ovalis, right? and this is your interventricular septum. Now, connecting to your right atrium as well as connecting to your right atrium and the right ventricle, there is a connection here in the atrioventricular septum. So this connection is nothing but called as the right atrioventricular aperture, because it is present on the right side and the aperture is present between the right atrium and right ventricle. So you call it as right atrioventricular aperture. So this is your right atrioventricular aperture, and this right atrioventricular aperture has walls. You name it as tricuspid wall because there are 3 walls. I have shown it only 2 here. I can't show it in a 3D fashion. Only shown it 2 here, but there are actually 3 walls. That is the reason we call it as tri. Cusps in the sense walls. So you call this right atrioventricular aperture, the other name for this is right side or right tricuspid wall. And on the left side, you find left bicuspid wall because there are only 2 walls here, right? So this becomes your bicuspid wall. They help in regulating the closure as well as opening of the atrioventricular aperture. So if we keep a camera here and if you see from the top, the exact structure looks like this. So it looks in this fashion. This is your septum for suppose. This is your right side wall. I mean right atrioventricular wall, or also called as tricuspid wall. Here you can find 3 cusps or 3 walls. This is the first one, this is the second one, this is the third one, right? And this is the central aperture. They are closing the central aperture so that blood cannot come from atrium to ventricle or ventricle to atrium when they are closed. And on the left side you find in this fashion. As I told you, it is a bicuspid wall. There are only 2 cusps or 2 walls. So this is how they look, right? This is the tricuspid wall. This is the bicuspid wall. Tri is present on the right side. Bi is present on the left side, right? So bicuspid wall, you also call it as mitral wall. The other name for bicuspid wall is mitral wall, right? Now, what is the use of these walls? Generally, when your ventricle pumps the blood, when your ventricle contracts, and during ventricular systole, when your ventricle contracts, the blood must enter into the pulmonary aorta on the right side and systemic aorta on the left side, right? So suppose this is your pulmonary aorta, right? And on your left side you have your systemic aorta, right? Now, I'll explain in detail about the pulmonary and systemic circulation later, but for a while just remember that this is your pulmonary aorta on the right side, and on the left side you have your systemic aorta. Right. So this black one represents your pulmonary aorta that carries deoxygenated blood from the right part of your heart, exactly speaking right ventricle to the lungs, and the oxygenated blood from the left part is carried out by your systemic aorta. Now, when your ventricle pumps, right, to exit the blood when your ventricle pumps or during your ventricular systole, the blood, due to the force of the ventricular contraction, the blood is pushed up, right? Now, these are your cusps or these are your walls. They are generally flipped inwards towards the ventricles, right? Look, they are flipped inwards into the ventricles. When your ventricle, during ventricular systole, when your ventricle contracts, the blood is forcefully pushed up. When the blood is forcefully pushed up, immediately these walls get hit and immediately they flip to horizontal level and they close the aperture. So this is how they look. When blood, during ventricular systole, when blood is when your ventricles are contracted, the blood is pushed up and hit these walls. When it hits these walls, immediately your walls become horizontal or they flip horizontally and they close this aperture so that blood cannot enter into the right atrium, right? So now definitely blood enters, must and should, it has to enter into your pulmonary aorta. Blood cannot enter into your right atrium. Why? Because your walls, the tricuspid walls of the right atrioventricular region or atrioventricular junction are completely closed. The same thing happens here. Due to some reasons, what exactly happens is, due to some reasons, if there is forced ventricular contraction or forced ventricular systole, the blood, as it is pushed up, it hits these walls so hardly so that these walls may have a chance to flip inwards into your atrium in this fashion. They may flip inwards like this. When they flip inwards, there is a pore developed here and immediately the blood flows into your right atrium. So this must not happen. So to prevent this opening, there are some special structures that are catching this or that are attached to these walls and they constantly pull the walls inward to prevent the flipping inwards into your atrium. So these are your walls like this, right? So to prevent these walls to flip inwards into atrium, there are some structures attached to these walls. They limit the flipping of these walls into the atrium. They limit till the horizontal level and they don't make these walls to extend into your right atrium. So those things or those strings are called as your chorda tendinae. So these are your chorda tendinae. So these chorda tendinae are attached to these walls and in turn these chorda tendinae are attached to your pyramid shaped muscles. These pyramid shaped muscles are nothing but called as your papillary muscles. As there are three walls here, three cusps here, I told you that this is a tricuspid wall, right? So tricuspid wall has three cusps, three chorda tendinae as well as three papillary muscles. So there are one more here. So these are your papillary muscles. One end of your papillary muscle is attached to the chorda tendinae string and the other end is attached to the surface of your myocardium, right? Now, when your ventricle contracts, right, when your ventricle contracts, if your ventricle is contracting at high pressure or very forced contraction of your ventricle, right, during forced ventricular systole, there is a chance of blood being pushed upwards so fastly so that it could hit these walls and make the walls to flip inward and obviously blood enters into your right atrium. So to prevent this, there are chorda tendinae here. Your chorda tendinae pull these walls inwards or pull these walls downwards so that your walls cannot extend into or flip into your right atrium. These walls are limited only till here. They cannot extend furthermore because down there are strings that are pulling it downward. So even if the wall want to extend, it can extend only till the horizontal level and close the atrioventricular apertures, right? So that is the reason why this chorda tendineae are present. On the right side, you have 3 papillary muscles with 3 chorda tendineae attaching to 3 tricuspid wall, 3 cusps of the wall. And on the left side, as I told you, it is bicuspid wall, you have only 2 chorda tendineae. So this is one, this is the other. Ventricular strings, you call it as ventricular strings. Right. Right. Now, you see this blue color mark in the anterior or in the starting part of the interventricular septum. A blue color line or a blue color membrane like structure that is present in the first 1/3 of your interventricular septum. This part is called as interventricular septum, IVS, interventricular septum. This is called as your interventricular septum. For some children, during the fetal life, this interventricular septum, after parturition, this interventricular septum must be closed. If this interventricular septum is not closed, this part of your interventricular septum, this is the membranous part of your interventricular septum, and this is the muscular part of your interventricular septum. So if this membranous part of your interventricular septum is not closed, or if this membrane disrupts, there is a formation of gap or a communicating junction between the 2 ventricles, so that the blood may exchange from right to left or from the left to right during ventricular systole. So when oxygenated and deoxygenated blood fuses or mixes together, all your body parts, all your lungs, all your organs are supplied by this mixed blood, and that is not good for the body, right? So you call this condition as ventricular septal defect, VSD, ventricular septal defect, right? Now, as I told you, I label the parts. This is your tricuspid wall, and on the left side you have your bicuspid wall, right? And these are your papillary muscles, and these are chorda tendineae, they are tendon like strings that are attached to the walls, right? So this is your foramen ovale, right? And foramen, after parturition, the foramen ovale is closed by membranous part, and then it becomes your fossa ovalis, right? So this is the general introductory part of your heart anatomy, right? In the next video, we'll be discussing regarding the layers of the heart. Thank you.